Good morning. I am Professor Swapna Varghese, Principal, MIT Kumaon College of Nursing, Lamachor, Haldwani. So today I am going to deal about the topic is disease condition asthma. So here first we will move the introduction part. So asthma, it's a condition in which a person's airways become inflamed, narrow and swell and produce extra mucus which makes it difficult to breathe. Asthma can be minor or it can interfere with daily activities. In some cases, it may lead to a life-threatening attack. So here, what do you mean by airway? Airway means it's respiratory tract that allows airflow. So here, what happens? A person's airway becomes inflamed. So many etiological factors are there. So due to the etiological factors that we'll deal later, due to the etiological factors, what happens? The airway becomes inflamed. After the inflammation, it becomes narrow, that is constriction. Then swelling will be there. That may produce extra mucus. So this extra mucus, because of the extra mucus, the person or the patient will be having difficulty in breathing. So asthma can be minor. The same time, it can interfere with the daily activities. In some cases, we can say asthma is a life-threatening situation or attack. So next, we'll move to the definition. Three definitions are mentioned over here. First definition is asthma is a chronic lung disease that causes inflammation in the airways of the lungs, making it difficult to breathe. The second one is a chronic disease in which the bronchial airways in the lungs become narrowed and swollen, making it difficult to breathe. Number three, the definition, one more, asthma is a condition in which your airways narrow and swell and may produce extra mucus which makes it difficult to breathe. As I have said earlier regarding the introduction part only, the airway becomes inflamed due to some etiological factors, and what happened? Narrowing, constriction will be there, and that will be leading to swelling, and that due to the swelling and the constriction, due to the etiological factors, even what will happen? The swelling will be there, constriction is there, and difficulty in breathing because extra mucus will be produced in the airway that makes a person or a patient difficulty in breathing. So you can go through the three definitions for a nursing student or a faculty, which is very easy for your examination. You can write it down. So here the definition 3 it is there. So the easy definition you can pen it down during the examination. So that is asthma definition. It's a chronic lung disease. It is affecting our lung. And what is happening due to the etiological factors? I have said that I will say regarding the etiological factors in the next topic. So here, after the etiological factors in our body, the airway part is affecting, inflammation is there, swelling is there, constriction is occur, extra mucus production, that will lead to difficulty in breathing of a person or a patient. And it is in some cases, we have said it's a life-threatening condition. So next, we'll move the types of asthma. So many types of asthmas are there. First one, we will deal the adult onset asthma. So here in the adult onset, what do you mean by adult onset? That is adulthood. What is adulthood? What's the age? That is from 20 age. So it develops in adulthood, that is 20 age. Prolonged exposure of certain workplaces materials may set off asthma symptoms in adults. Different illness, viruses or infections can be a factor in adult onset asthma. Hormonal fluctuations in women may play a role in adult onset asthma. Next is, some women first develop asthma symptoms during or after a pregnancy. So here from 20 age, adulthood means what is, it's 20 age. So prolonged exposure, what do you mean by prolonged? It is continuous exposure of certain workplace. Some persons are working, their job is in workplace, like bakery will be there, next is cement factory, asbestos, so some detergent, pesticide. So these all workplace materials that also set of asthma symptoms in the adults. Next is different illness, viruses or infections can be a factor in adult. Not only the exposure of some certain chemicals or in the workplace. So here Again, in the case of adult onset asthma, what is happening? Viruses, especially COVID-19, influenza viruses. In the case of infection, pneumonia, sinusitis. What do you mean by sinusitis? It is inflammation of the sinus. So in the case of pneumonia, in the case of sinusitis, that is the infections and the viruses, COVID-19 or influenza, etc. That also a factor of onset of this what? Adult onset asthma. Next is hormonal fluctuations in women may play a role in adult onset asthma. So what here hormonal fluctuation? Estrogen and progesterone level variations that may affect the lung function. What happening? It is resulting in shortness of breath as well as trouble breathing. So definitely the women will experience hormonal imbalances are there or changes are there. Which all are the hormones? That is estrogen and the progesterone. Next is related to some women first develop asthma symptoms during or after a pregnancy. What is happening here? It is the cases that hormonal changes, already I have said regarding the estrogen and progesterone imbalances or changes will be there. So here the before and after pregnancy, the during the pregnancy or when the woman is pregnant, so what is happening? Mechanical pressure will be there from the uterus. Okay, that also will be a cause. Then hormonal changes and immune system changes. These all will be leading to what is happening? Adult onset asthma. That is the person or the women develop asthma symptoms during or after a pregnancy, especially due to the estrogen and progesterone level imbalances or hormonal changes. Again, immune system changes and the pressure, the mechanical pressure from the uterus. Second one is, so that is related to adult onset asthma. Definitely it is leading the adulthood, that is 20 age. Clear. And again, I have said that workplaces is there. Women also experience, especially in the estrogen and progesterone level, that is the hormonal changes, pressure in the uterus, and again virus and infection. Virus I have said regarding the COVID-19, influenza virus, infection in the case of pneumonia and sinusitis. This all will be leading to the cause of adult onset asthma. Next is the same, it is allergic asthma, that is extrinsic asthma. From the name only, we are sure that this type of asthma, extrinsic asthma or allergic, it is due to the allergic reactions. A person is having the exposure of allergic contents. Dust will be there, pollen grains. What do you mean by pollen and all? That is the particles of the powder. The powder flower particles consist of. Some are having dander and all. What is dander? That is pet animals, feather, hairs and all, dog, cat, birds and all. So it is a most common type of asthma here. About 90% of kids with childhood asthma have allergies compared with about 50% of adults with asthma. It is due to allergens like pollen. I have said regarding the particles, the powder in the flower, dust maze, dust particles are there. Next is mold. What do you mean by mold? That is related to fungus. So due to the allergic reactions, allergic particles, even a person is going outside, they are having allergic reactions, especially dust during the summer season. And the winter season, what is happening? The cold. So these all things will be affecting a person, that will be leading to the airway constriction, inflammation, and extra mucus will produce, that will leads to asthma. So asthma is a chronic condition. It is affecting our lungs, airways, bronchi and all. It is sometimes life threatening even. Next type of asthma is asthma COPD overlap. What do you mean by COPD? Chronic obstructive pulmonary disease. What is chronic obstructive pulmonary disease? It is the inflammation lung, condition of the lung. It's inflammation that consists in the or condition of the lung. So here ACO. What is ACO? Asthma COPD overlap. So it consists of both asthma as well as chronic obstructive pulmonary disease. ACO is a condition where a person has symptoms of both asthma and COPD. It's an overlapping. Both the person will be suffering from asthma, COPD. It's an overlapping of both asthma and COPD, chronic obstructive pulmonary disease. That means lung disease. People with ACOS, that means asthma, COPD overlap, have more frequent and severe symptoms than people with asthma or COPD alone. When a person is having asthma alone, when a person is having COPD alone, but here the more frequent and severe symptoms will be showing in the asthma COPD overlap, including difficulty breathing, wheezing. What is wheezing? The sound, whistle sound we can hear, frequent coughing and excess mucus. But in other ways, they are different. So the main thing is asthma condition, airway obstructions there due to the extra mucus production, and that will be leading to difficulty in breathing. So in the case of asthma COPD, that is COPD is chronic obstructive pulmonary disease. So it's an overlap. It's a combination of both asthma as well as the COPD. Next type of asthma is exercise induced bronchoconstriction, EIB. So here it is a lung condition that occurs when airways narrow during physical activity, making it difficult to breathe. The next point is symptoms include coughing, wheezing, chest tightness or pain and shortness of breath. They usually develops 5 to 10 minutes into exercise. So clearly it is exercise induced bronchoconstriction. What do you mean by exercise induced? What is induced? That means cause or produce. What are the exercise? Hard exercises. Hard exercises produce bronchial airway constriction. Narrowing will be there. So here already said regarding the asthma here, what is happening? The bronchial area, that is the airway will become narrowing, constriction will be there. How the airway? But it is becoming narrowing or constriction. That the same narrowing constriction and the inflammation or infection is happening. So here extra mucus production, that will be leading to obstruction will be there. So that will be the patient is having or the person is having difficulty in breathing, especially due to the constriction of the bronchial airway. So here some hard exercises are there. These hard exercises that will make our airways narrow, and that will be leading to physical activity. Which physical activity? Hard exercises. Definitely hard exercises will make a person bronchial airway narrow constriction. So here again difficulty in breathing. The symptoms include coughing, wheezing means whistling sound is there, chest tightness. What do you mean by chest tightness? Heaviness will be there. Clear? Heaviness, then pain and shortness of breath. And they usually 5 to 10 minutes into exercise. When the exercise will start, after the exercise, hard exercises. Clearly it is mentioned hard exercises that will be leading to the bronchial area constriction, that is bronchoconstriction. Next is number 5 is non-allergic asthma, that is intrinsic asthma. So first one was related to adulthood asthma, then regarding the allergic asthma, then asthma COPD overlap, next exercise induced bronchoconstriction, next is non-allergic. So it's a type of asthma that is not triggered by allergens like dust mites or pollen. It's less common than allergic asthma, affecting about 1 in 5 people with asthma. Next point is it may be triggered by a wide range of non-allergy related factors, includes viral respiratory infections, exercise, irritants in the air, stress, drugs and certain food additives, weather conditions. So here what is happening? What is intrinsic? What do you mean by intrinsic? Natural. It is inborn. It's not related to any of the dust particles. Clear? It's not related to any of the allergens like pollen grains. What is pollen? I have said regarding the powder of the flower, that particles. Okay, that consists. So here it is not triggered. What do you mean by triggered? It is not caused. Trigger means caused or produced. Okay, or activated. It's not caused by allergens like dust, mites or pollen, but what is happening over here? It is triggered by a wide range of non-allergy related factors, like see here in the air, sometimes in the factory or through the factory, viruses, okay, airborne disease are there, some chemicals will be there. So when a person is inhaling, that air consists of particles like chemicals or virus, okay, then stress also will be a leading cause of the asthma, bronchoconstriction, drugs and certain food additives. Some drugs are there that also will be leading cause here. And next to certain food additives. Food additives, what it is? Sulfates. We are using sulfates and all in the food additives. So these sulfates and weather condition. What is weather condition here? In some person, they are having summer time, during that summer period, during the winter cases and all. So winter cases, what is happening the season? Here the winter season, the cold will be there. That also will be a leading cause here. And next is the summer season, dust particles will be more. Clear? So that also will be affecting. So here the wide range of non-allergy related particles, it is stress, drugs and all, certain food additives. Clear? Next we can move to the occupational asthma. Occupational asthma, from the word only we can say it is related to the workplace. A person having the job in the workplace. So here it is triggered. Triggered means what? It is activated by workplace irritants such as chemical fumes, gases or dust. So some chemicals are there, some gases when they are working inside the factory. Especially I have said regarding the cement factory, bakery items are there, bakery factories are there, and everywhere when the chemicals, detergents are there, so fumes are there, so this all will inhale a person, then that will be leading to difficulty in breathing. How? By the airway constriction or narrowing, extra mucus production, and this inflammation and extra mucus production will be leading to difficulty in breathing of a person or a patient. Symptoms include coughing, wheezing, chest tightness, shortness of breath, nasal congestion, breathing difficulty, eye irritation, runny nose may also be present. What do you mean by runny nose? It is known as rhinorrhea. Rhinorrhea means what it is? Continuous mucus discharge from the nose. It's a continuous mucus discharge from the nose. Runny nose is a medical term, is rhinorrhea, continuous mucus discharge from the nose. So here the occupational, that is a workplace, occupational asthma, workplace irritants will be there, that will be leading to asthma. Which type of asthma? Occupational asthma. Next is the risk factors. So here we'll move to the risk factors. Very important question for the B.Sc nursing or GNM nursing students. The asthma, the entire asthma essay will be asking, short notes also will be asking related to asthma. So here the family history. So clear in the case of family history, what it is mentioned, having a close relative with asthma such as a parent or sibling. Who is sibling? Brother or sister. Increases the risk of developing asthma. When the parents are having asthma, the same time the siblings are having, that is brothers or sisters are having asthma, definitely chances are there. What do you mean by risk factors? Actually, it is increased chances of developing a disease. Risk factors meaning is increased chances of developing a disease or what? Health problem. So here the family history, any of the person at home like parents or siblings, brother or sister is having the type of asthma, definitely chances are getting developing the disease, that is asthma condition. Next is allergies. People with asthma often have other types of allergies such as food or pollen allergies. Pollen, I have said, that is a particle that is flower ke under, what it is there? It's a powder that consists of powder. That season will be there, in some cases are there. So definitely the person or the patient has to be take care their health by covering the mask and all, or else will get the difficulty in breathing because of this pollen allergy. So allergies, so many types of allergies are there. Sulfates consist in the food, and pollen particles I have said regarding that. Dust mites, even dander. What is dander? I have said even at home, the family members or the person or the patient is having pet dogs, pet birds are there, then cats will be there. So that feathers, hairs and all, definitely that also will be inhaling the bronchial airway, will leads to constriction, inflammation as well as production of extra mucus. Next risk factor is obesity. Being overweight or obese can increase the risk of developing asthma and make asthma symptoms worse. Why? How it is related? Obesity, overweight and obesity causes substantial changes to the mechanism of the changes in the lungs of the chest wall. It is affecting our chest wall as well as the lungs, because extra fat on the neck, the chest can make it difficult to breathe. A person is having extra fat on the chest or the neck area can will be make it difficult to breathe deeply. So here that is related to the overweight or obese, that increase the developing risk of asthma, and that can make the asthma symptoms worsen even. Next, risk factors: tobacco smoke. Exposure to tobacco smoke as a child or adult increases the risk of developing asthma. It's a dangerous risk factor here, tobacco, because this tobacco smoke, it consists of nicotine that definitely irritates what? The airway irritation, and that can cause inflammation, swelling, as well as narrowing of the airways. So it's an advice to the youngsters that don't use the tobacco smoke and all. You can skip the cigarette smoking and all, because it consists of nicotine, and this nicotine will be irritating our airway, that will be leading to the constriction of the bronchial airway, and definitely will causes extra mucus production, that will be leading to breathing difficulty, and it will be a risk factor of asthma production. Next is environmental factors: exposure to indoor and outdoor air pollution, house dust mites, molds, and other environmental allergens and irritants can increase the risk of asthma. It's a main factor here, because when a person is having the indoor or outdoor any activity, when they are going outside, air pollutions are there, dust particles are there, molds. What is mold? Here it is fungus. So these environmental allergens, outdoor or indoor activity, these environmental pollutions or allergens or irritants definitely developing chances of the asthma. Next is occupational hazards. What is occupational? I have said that workplace, when a person is having job, breathing in chemicals, fumes or dust in the workplace can raise the risk of developing asthma. So chemicals, so many chemicals are there here. So these chemicals means paint, ammonia, chlorine, that are the chemicals. Fumes are there. Then, chemicals means it is a bleach and all, bleach, detergents and all. In the case of fumes, that will be paint, ammonia. And in the case of dust in the workplace, when a person is working in the workplace, due to the chemicals, due to the fumes and all, the chemicals I have said, even pesticide, some bleach, detergent also, that will be a leading cause of irritating the airway. Then fumes I have said regarding the paint, ammonia, chlorine. Then the dust particles, these all will be in the workplace can raise the risk of developing the asthma. Next is related to the early life events risk factor. Events in early life such as low birth weight, prematurity, exposure to tobacco smoke, and viral respiratory infections can increase the risk of asthma. So here what is happening? Low birth weight, that lungs are not fully developed. Low birth weight babies are there. Here the lungs are not fully developed. That means small airways, that is prone to the obstruction of the asthma. The lungs has to be developed. So in the case of low birth weight, what is happening? The lungs are not fully developed. That will be leading to the small airway, that leads to difficulty in breathing or shortness of shortness of breath. Clear? So next is regarding the weather changes. So weather changes, cold air can cause airway congestion and can increase in the mucus production, which can lead to asthma attacks. I have said regarding the weather changes, what is happening in the weather changes when a person is having the already asthma is there, or if the person is not having asthma, some they are having the chances of developing the asthma or developing the disease condition. The cold air, especially during the winter season, the cold air can cause airway congestion. It is directly affecting our chest, and what is happening? Congestion will be there, and that can increase the mucus. The same only here, airway constriction will be there, leads to production of extra mucus, which can lead to asthma attacks. Next, cooking with gas. Cooking with gas stoves can increase the risk of asthma attacks, wheezing, and breathlessness. What is happening here? What are the, why is cooking gas also is a risk factor for the asthma person? Nitrogen oxide, will be there, carbon monoxide, smoke and fumes, cooking gas also. That's why we are saying that ventilation is very important. When a person is inside the kitchen, the ventilation is very important, because through the ventilation, the air has to be pass and enter, and the fumes are there. So nitrogen oxide, carbon monoxide, and the smoke and the fumes of the gassing stove, what is happening? It should get out from the area where the kitchen the person is cooking. Okay, so the entry and the pass of the air will be there. The same time the fumes has to be out of the kitchen area, or else what will happens? It will leads to constriction, wheezing will be there, and will be a chances of risk of asthma developing in some person. So that is related to the risk factors. Now we will move to the etiology. Airborne allergens such as pollen, dust mites, mold spores, pet dander, or particles of cockroaches waste. I have said regarding the pollen. Pollen means the particles, the powder, flower powder. Next is dust mites, dust particles. Mold spores means it's fungus. Pet dander, I have said regarding the pet animals, feather or hairs and then this cockroach waste also. So these are all the things definitely if it is inhaling, and that will be a cause of our asthma. Respiratory infections such as the common cold, then physical activity, hard physical activity will be leading to constriction of the bronchus airway. That is, I have said regarding the types of asthma also. Cold air also will be affecting or it's a main part or cause of the asthma. Next is air pollutants and irritants such as smoke, certain medications including beta blockers, aspirin and non-steroid anti-inflammatory drugs, NSAID, such as brufen, Advil, Motrin, and naproxen, sodium and all, strong emotions and stress. So what is happening here in the medications? Some beta blockers, example is propanol. So what is happening? The trigger exacerbation will be there, airway becomes swollen and inflamed. So that also a cause of asthma. Some medications are there, this all will be irritating, especially bronchodilators. Asthma bronchodilators will be irritating the our or worsening the disease condition asthma. Next is strong emotion and stress. What is happened? During the strong emotions and stress, the patient will cry, that will be leading to mucus causing breathing crisis will be there. So stress can lead to mucus cause breathing crisis. Next is regarding the etiology, sulfites and preservatives added to some types of foods and beverages including shrimp, dried fruit, processed potatoes, beer and wine. So what happening here? Sulfites. Why sulfites are using? To kill the bacteria and fungus in the food. So sulfites, we are using to kill the bacteria in the food as well as in the even the fluids also. So these sulfates can harm, that will be a leading cause of our asthma disease condition. So food and beverages, they are using the sulfates and that including shrimp. Shrimp, you know that it's a fish actually. Okay, so this all the dried fruit, processed potatoes, beer and wine, everything it consists of sulfates, and these sulfates are using to kill the bacteria and fungus in the food and beverages. That is a main cause of asthma. Next, gastroesophageal reflux disease, a condition in which stomach acid back up into your throat. So here this condition, what is happening, the stomach acids are there, it will be regurgitation will happen, so that also will be affecting our airway, that can cause to a leading cause of the asthma. Next, we will move to the clinical manifestation, shortness of breath. That is the signs and symptoms of the asthma consist of chest tightness or pain. Chest tightness means heaviness will be there. Wheezing when exhaling, which is a common sign of asthma in children. So here what is happening? Whistling sound will be there. High pitch whistling sound when a person is breathing. Trouble sleeping caused by shortness of breath, coughing or wheezing. Coughing or wheezing attacks that are worsened by a respiratory virus. Clear? So here the respiratory virus, cold or flu a person is having, so that will be the signs or symptoms. A person is getting wheezing, shortness of breath, difficulty in breathing will be there. So especially in case of children also, it's a common signs wheezing, that is high pitch whistling sound while breathing. Shortness of breath will, that is dyspnea, breathing difficulty will be there. Chest tightness means that is related to heaviness of the chest, breathing difficulty, nasal congestion, runny nose I have said, rhinorrhea, nasal discharge will be there. Symptoms may occur during the day or night. If they happen at night, they may disturb your sleep. It is clear that when we are having a cold, when we are having fever, the congestion will be there, cough will be there, the mucus secretions will be there. We will go to the wash basin to expel that sputum, because definitely it is affecting the or disturbing our sleep because of the nasal congestion, breathing difficulty will be there. It's a small thing related to cold. It's a small thing related to a person is suffering from fever. But just to think, when a person is suffering from asthma, how much difficulty they are facing, because the bronchial airway is having, especially the constriction will be there. The bronchial airway full, it consists of the airway narrowing, and the sputum productions are there, mucus, and that will be leading to the difficulty in breathing of a person. Next, we will move to the pathophysiology. So here the pathophysiology, trigger factor. What are the trigger factor? That is, etiological factors are there. Dust particles, pollen, dander are there. Okay, chemicals are there. Okay, so irritants. What are the etiological factors I have mentioned regarding the leading cause of the asthma? So that will leads to airway inflammation. When a person inhaling the dust particle or any chemicals or fumes or any of the dander, pet dander, that means the waste particles of the cockroach even. So this all will be a trigger factor that will be leading to the airway will be inflamed. Inflammation will occur first. These inflammation, what is happening? Hypersecretion of the mucus, airway muscle constriction, swelling bronchial membrane. So once when the allergen particles are entered or inhaled by a person, airway will be getting inflamed, and that will be leading to mucus production. Hypersecretion of mucus will be there, and constriction, muscle airway constriction, swelling of the bronchial airway are there. These three, that is the secretion of hypersecretion mucus, airway constriction, and swelling, leading to narrow breathing passage. That means the passage is becoming, the constriction, bronchoconstriction is happening due to the inflammation and the secretion of the mucus and the swelling. So these are the signs or symptoms occurring for the person or the patient is suffering from asthma. Wheezing, cough, shortness of breath, tightness in the chest. So everything is due to the etiological factors, that is the allergens, especially the dust particles and even chemicals, fumes, smoke. These all will be irritating the airway of the person or patient, that will be leading to the wheezing, cough, and signs and symptoms that has mentioned here. So diagnostic evaluation. So in the diagnostic evaluation, when a person comes to the hospital, first we'll meet the doctor and the nurse, and we'll start first the history collection. It's very essential that the doctors and nurse will start, what is your name, or what are the problems, the chief complaints, present medical history, past medical history, present and past surgical history, what you are facing now, what is your real problem now. So here the history collection, then the physical examination, head to toe physical examination will be there. Apart from the physical examination head to toe, some other more investigation also will be performed, that is spirometry. This test estimates the narrowing of your bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. This is monitoring the lung function, inhalation and exhalation, whether a person is having any difficulty, how much the deep breath and how fast you can breathe out. So monitoring of the lung function, we are using the spirometry investigation. Next is peak flow. Peak flow meter is a simple device that measures how hard you can breathe out. It's a simple measure. It's also for the assessing our inhalation and exhalation monitoring. Next is related to the lung function test to measure your breathing and to diagnose asthma. It's very clear, we have to assess what's the happening in the lungs. So the monitoring of the lungs, inhalation, exhalation, the breathing, everything, it's very essential for a person. So the doctor will advise to go for the lung function test. Next is related to the methacholine challenge. That is, methacholine is a non-asthma trigger. When inhaled, it will cause your airway to narrow slightly. If you react to the methacholine, you likely have asthma. This test may be used even if your initial lung function test is normal. When a person, first will go for the spirometry and peak load, that time when a person is having the lung function test is normal, again the doctor will say regarding or advise regarding the methacholine challenge, that is a test. So when a person is having reacting to the methacholine, definitely they are having likely of asthma. That is related to methacholine challenge. Next is chest x-ray. Obviously the chest x-ray, that is it can help the identify any structural abnormalities or diseases such as infection. When a person is having infection, definitely with the help of the chest x-ray, we can identify the abnormalities or disease. That will be helpful for the doctors as well as nurses to diagnose which type of disease condition the person is having. Here in the case, it will be affecting what is the main cause or the real thing of the disease condition, will be helpful for identification of the abnormalities or any disease condition present in the patient. Next is regarding the allergy testing. Allergy tests can be performed by a skin test or blood test. They tell you if you are allergic to pets, dust, mold or pollen. Pets, I have said regarding the hairs and all of the pet animals, dust particles, you know, mold is fungus or pollen is the flower particles, that is the powder of the flower. So here with the help of the blood test or skin test, we will come to know the person or the patient is suffering from which type of allergens. Maybe it is due to food items, maybe due to dust particles or any fumes and all, or maybe due to any of the chemicals. So with the help of the blood test and skin test, we are able to identify which type of allergens is happening for the patient. Next is related to the nitric oxide test. So clear in the nitric oxide test, this test measures the amount of the gas nitric oxide in your breath. When your airways are inflamed, a sign of asthma, you may have higher than normal nitric oxide level. So here in the case of the nitric oxide test, you may have higher than normal nitric oxide level, then we are able to identify, because nitric oxide also I have said in the cooking gas. So cooking gas consists of nitric oxide. When a person is inhaling more nitric oxide, so we will come to know especially through the nitric oxide test, the person or the patient is having nitric oxide levels are higher. So that also will be helping our asthma diagnosis. Next is sputum eosinophils. This test looks for certain white blood cells, eosinophils, WBC, in the mixture of saliva and mucus, sputum. So here what is happening? You discharge during coughing. Eosinophils are present when symptoms develops and becomes visible when stained with a rose colored dye. So here sputum eosinophils, that means white blood cells, we are able to identify the mixture of saliva and mucus. Sputum in the person or a patient, that will be identified the sputum eosinophil, that is WBC. So we are able to identify the person is having how many WBC present. So that also will be helpful for the diagnosis of our asthma for the doctors and the nurses. So here about the diagnostic evaluation. Now we will deal a medical management here. So after the clinical signs and symptoms or the testing and all, the diagnostic evaluation, next the doctor will diagnose the patient is having asthma and the doctor will prescribe some medicines. So that is medical management we will deal. Inhaled corticosteroids, example rhinocort is here. Then leukotriene modifiers, example montelukast. Combination inhalers, example fluticasone. Then theophylline bronchodilators, short-acting beta agonists are there, albuterol. Anticholinergic agents, example abratopium. Then next is oral and intravenous corticosteroids, it is prednisone. Allergy medications, example immunotherapy is all. So these all are the medications help the patient to treat the difficulty in breathing, wheezing, obstructions are there, and to treat the infections. Next, shortness of breath, allergic rhinitis are there. So these all the medications will helping the patient to treat these types of symptoms and signs. Clear? Next, we will move the surgical management. So even the surgical treatment, when we are going to plan, when a person or a patient is suffering from asthma diagnosed by the doctor, and what will happen, the medical management we will start first with the help of the medicines. When these medicines are not able to cure the asthma, then the patient has to go for the surgery, that is the doctor will uh, say or advise regarding the surgical management. That is here in the case of the asthma, bronchial thermoplasty. What is happening in the bronchial thermoplasty, or what procedure, what is done in the bronchial thermoplasty? Treatment for, it's for the treatment for severe asthma. To open the airways, a catheter is advanced through the bronchoscope. With the help of the bronchoscope, what is happening here, a catheter will be advanced here. So use gentle heat to shrink. Shrink means what? To make it small. Okay. The smooth muscles in the lungs. So reduce the muscle associated with airway constriction, and in asthma patient, it will reduce the constriction. Already said what is asthma? Asthma, it's a chronic lung disease, and what is happening in obstruction? How? When the airway becomes inflamed, swelling will be there, then narrowing, constriction will be there. These narrowing constrictions will be occurring, that is leads to extra mucus production and difficulty in breathing is happening here. So we have to make the airway constriction, we have to relieve. So this will be helped due to the help of surgical management bronchial thermoplasty. In case of when the patient is not reacting to the medicines, and again the patient is having the constriction in the bronchial airway, then the doctor will advise for the surgical management, that is bronchial thermoplasty. Here what is happened, the airway opens with the help of the bronchoscope, catheter will be introduced, and what is happening, we are reducing the airway constriction there with the muscles associated with the airway constrictions in the asthma patient. So that also is a clear management here, surgical, when the patient is not reacting to the medicines. Next, we will go to the nursing management. It's very important for a nurses, that is when the surgical or when the medicines are there, when the patient is admitted in the hospital, it's the responsibility of the nurse to do the management, not only the surgical and medical, with the help of the doctors, the nurse has to take care of the patient. So here the nursing management, clean the house at least once a week and wear a mask while doing it, avoid pets with hairs or feathers, wash the sheets, pillowcases, mattress, pads weekly in hot water, keep the humidity in the house low. It's very essential. We have to clean the house at least once a week, and the mask is very essential when cleaning the house, and we have to avoid the pets. I have said regarding the pets, feathers, the pet animals, means the hairs will be there. These all things we have to avoid. Even the person is suffering from the asthma, then we have to wash the sheets, pillows and all in the hot water. Maximum, we have to be provided the humidity in the house low. Next is related to the administer bronchodilators, corticosteroids as per order, administer low flow humidified oxygen to prevent the hypoxemia, administer, what do you mean by hypoxemia? That is low level of oxygen in the blood, administer IV as per order to prevent the dehydration, check the vital signs, provide psychological support. So here administer IV as per everything, the nurse has to be provided medicine, yeah, oxygen or any of the care with the help of the doctor prescription only. So we have to order the doctor prescription. And dehydration, that is what is happening, because we have to prevent the dehydration. Dehydration produces histamine, and this histamine is produced, allergy is triggered. Allergy is produced because of the histamine. When a person is having dehydration, due to the dehydration, what will produce? Histamine will produce. Histamine is produced, allergies are triggered. So here administer the IV as per the order doctors, and bronchodilators or corticosteroids, what are the medications as per the physician's order, the nurse has to follow. And I have said regarding administer low flow humidified oxygen, because what is happening, to prevent the hypoxemia. What do you mean by hypoxemia? Lower level of oxygen in the blood, and the main thing is provide psychological support. Definitely the person and the patient, the family members will be having the stress or tension related to the disease condition. So it's our responsibility being a nurse that we have to provide the psychological support. 24 hours a nurse will be there in the bedside area of the patient. So we have to be very down to earth. We have to take care, and I have said regarding in some classes and all mine regarding the compassion, that we have to listen the patient problem a calm way, and we have to solve the patient issues in a good manner and good way. That is our nurse's responsibility. But what are the things you are providing a care or any procedures or any medication, you have to take the permission and the prescription advice from the doctor even. So here next we'll move to the complications. So here the complications are sleep disturbance will be there, disturbed recreational activities, permanent narrowing of the bronchial tubes, pneumonia, respiratory failure, medication side effects like rapid heartbeat, lack of sleep, gastroesophageal reflux. So here definitely sleep disturbance will be there. The patient is suffering from asthma. So here mucus secretions are there. Wheezing sound will be there, cough is there, shortness of breath will be there. So the patient's sleep will be disturbed. He will be going to the bathroom to expel the sputum and all, and the nasal congestion. This all will disturb, and definitely it will be disturbed of the sleep. Then disturb recreational activities, not able to do some games and or not even to do even household activities because of the dust particles, the fumes and the chemicals. So he will be or she will be disturbed due to the asthma signs and symptoms. Permanent narrowing of the bronchial tubes. What is happening here? That is constriction. Already said that some cases even the patient is not going for surgical management, even the patient is not taking the medications as per the doctor's order, the physician's order, definitely what will happen? Permanent narrowing of the bronchial tubes. That is a big complications, and it is life-threatening and hectic situation that time for the patient or the person. Next is pneumonia. That also a complication. If it is the asthma is not treated in the proper way, definitely the patient or the person will go for pneumonia. What is pneumonia? It is the inflammation and fluid in the lungs. Respiratory failure will be there. Obviously, when a person is not taking care of the lungs, along with the help of the doctor's advice or prescription, and that will be leading to respiratory failure. That means our lungs will be collapsed. Medication side effects also are there. Heartbeat will be rapid, lack of sleep, and gastroesophageal reflux will be there. So these all are the complications. So today's topic was related to asthma, and here I have said regarding what is asthma. Asthma, it's a chronic condition of the lung, and here what is happening due to the etiological factors. I have said some pollen or the pet dander, some chemical fumes and the dust particles. So this all will make inhaling exhalation. After that it will be affecting the airway area of the person, so that will be leading to a narrowing of the airway. Then swelling will be there due to the inflammation and the particles irritants, that will be leading to extra mucus production that can cause difficulty in breathing of a person. So asthma in some cases it is a minor cases, but in some cases definitely it is a life threatening cases. So it's a responsibility of the person, even the family members, those who are suffering from the asthma, that you have to take care. Please avoid the person is having that means you have to avoid the dust particles. If you're going somewhere, try to wear mask, and at home also clean the area in a good way, and that time also you have to wear the mask and avoid the pet animals, because that also that will be leading cause of the hairs and the cockroach waste are there, and feathers of the birds, hairs of the dogs and cats. This all will be a leading cause of asthma. So try to take care of yourself, especially during the summer season, winter season. That will be leading to dust particles and cold and all will be leading cause of the asthma. So try to take care of yourself. If you are having any kinds of symptoms, that the person and the family members can move to the hospital with the help of the doctors and nurses. You can go for the further investigation, will diagnose asthma, so you can take care of your health. So thank you once again. So that's the wind up of my topic today's asthma. Thank you.